Medical school has been the dream for the longest time, and coming to Burnett School of Medicine at TCU, I just knew that dream was coming fulfilled. So walking in to the steps of orientation, there was a lot of excitement, but there were so many friendly faces, and I think that's what stood out to me. My grandma and grandpa were doctors in India. So growing up, while we didn't really have a lot of connections, like physically, we would talk on the phone a lot, and they would tell me stories about their experiences being a doctor. And in India, it's very different because your community is the patients. So my grandma always said that her patients were her best friends. And I just fell in love with that idea that someone could be treated, but also be considered part of the family. And that's how you want to treat others. When I decided to be a doctor and I wanted to fulfill that dream of my own, she was just so excited, and that's all she can talk about. She only refers to me as Dr. Simar when she talks to me, and I think there's just this joy of continuing on a legacy that was started half of the world away from you. Grandma actually gave me her stethoscope right before I joined medical school. So I have her old stethoscope and my new stethoscope right next to each other, and it has her name engraved on it. So it's the one she used for 50 years. I chose general surgery, and I don't think there's any other field that I fit more into. And every time I've been in an OR, but also just working with my surgical patients, I've just felt that there's this problem that can be fixed, and I can have an impact on someone. Yes, I feel ready. I think that there was, again, a lot of imposter syndrome initially when I entered medical school of how I'll be able to be a doctor. But throughout these 4 years, I think having our early clinical experience and just getting comfortable with talking to patients, attendings, and those around me, I just feel that I'm ready.